I guess one thing I want to say before we start getting into these conversations is that for the decisions that we're going to make here today and in the future, not just going to be made by this board, they're going to be made by all of us collectively, because this is a pretty big risk that we're taking for our community. Once we open this up, this is an open invitation to anybody. They can show up in our community. Where they come from, we don't know. We have no control over. So I want everybody to keep that in mind as we go forward and making these things. And last night, a lot of the focus was on our own community members and our own kids and how to provide things for them. And it's not going to be just about them. It's going to be about everybody. So please keep that in mind. I guess the other thing too we need to think about as we develop these plans is how we're going to implement them. I don't know if enforcement is the correct word to use, but there's somebody, a group or whoever it's going to be is going to have to be able to say, hey, this is the plan. This is what we agreed on. We don't know who that's going to be.
So the action side of it, like we're talking about.
Yeah. I mean, it's great to have this plan on paper that looks really good, but can we actually implement it?
If I may, since we're talking about one of the things, the biggest challenge is going to be that doing this is that when the state allowed 5,000 people to stand in a park and protest, everybody in society is going, look, this is ridiculous. We got county governments, city governments, state governments trying to lock us down, but we have the state government allowing 5,000 people to basically congregate and protest in whichever form or fashion they want without enforcement action. And actually at the request of, as long as they're not breaking the law, stand down and don't engage. So this is the dilemma we're facing when we look at things, bringing things into the public light, is that you have a government, basically body, that is allowing and advocating for people to get together and protest because of certain actions that occurred somewhere across this country. And they basically turn a blind eye to the COVID issue. And that's what's happened. And so when you open that door for those type of behaviors, and then you want to bring that door closed again on the American people that aren't violating the law or not protesting, they want to get out and live their lives, you're finding yourself in a very, very large dynamic or dilemma that you want to fix. And I think that's where we're at today, is that the things that have transpired across this country in the last 2 weeks or 3 weeks since George Floyd and Ray Brooks down in Atlanta have posed a huge public health risk across the entire country. But the door was opened by people that made decisions. Instead of enforcing that and stopping those things, they're saying, hey, you can't do this. They allowed it to happen. And now you've got your taxpayers and your community citizens who are saying no. I heard it last night at the drive-in movie. People, that was one of the number one comments people made to me, is why are we still locked down when people can do those things? So it's not just those people coming in. It's everything that people are just fed up with it. And when we talk about enforcement, you have the legal ability to do so. And that's the thing that I hear all the time. Is there a constitutional liability or legal ability by law or whatever else? Because what the governor is given over and over and over is guidance and then directives. And directives, if you look at the definition, is guidance to encourage or discourage particular behavior based on policy and procedure. Well, citizens, we don't have policies, we don't have procedures, and it's just guidance. And when it comes to mandatory mask wearing, the President Trump said the best is we have a constitution. So keep those things in mind as well when you start doing these things, because it all comes out to play. And I don't think that we need to have a protest for enough people over whether the pool's open or whether we go through people's backyards. I don't think we want to have that type of thing, but there's a lot of stress and there's a lot of angst out there among our community members because they're tired of being locked in and locked down. And a lot of it, a component of that is to go like, where's the personal responsibility upon the citizen? And as the president of the rodeo, that's one of the things that we've looked at and the NRA's looked at is that if you're sick, stay home. If you're compromised, stay home. If you're uncomfortable being in this situation, stay home. And leave it, but there's gotta be some personal responsibility among citizens of the state of Montana. It's not necessarily the government's responsibility, and nor do they have the authority to babysit and dictate how a person lives their lives. And unless we get rid of the Constitution of the United States of America, the state of Montana, and go into martial law, then we have a different component of that. But until that day, those things can't happen. So, I know I come down here and monkey your guys' meetings all the time, but as the enforcement side of these things, and what I see and what I hear about everything else, I think it's good advice to give. So, I'm not an attorney, I'm just a cop. So, but that's what I have. And I'm open for discussion too, so. And if I can, the other thing is, you guys have any questions about the guidance from the rodeo, the NRA guidance that I've disseminated, I don't know who's all got it, but, I can't remember who I emailed it all to. I don't think I emailed it to you, so I don't have your email. I can't remember if I emailed it to you, though, I handed it to somebody, Daryl and Sean. So there's 2 phases of that plan, so.
I guess my question on the NRA thing is, I got a couple. Number one thing is the waiver thing. I don't see where that waiver is going to do anybody any good. My concern is that if you get somebody in there that has COVID and then we end up going back to phase 1, and we get a business owner decides that we're shut down, so now he's going to sue the rodeo. Is he going to sue the rodeo? Is he going to sue the county? Who's he going to go after? Because that waiver, he didn't sign the waiver, but inadvertently, you've affected his business by making the whole county go back to phase 1.
So the waiver is actually just for the contestants. That's what they have to fill that out before coming in, not the citizens. But their sign, if you look on the back, the last 2 pages of that document are both signs. And one of them is to the public. When you enter this is the only risk. You enter it and you relieve the responsibility of the NRA and everybody else that's involved. You walk through the gate. We have the signs being made right now. They're 2 by 3. They're going to be put at every gate. And there's one for contestants, there's one for the public, and the one for the public basically says, I can actually read through verbatim, because I think it's important, because of that one liability right there. That says, warning to the message to the public, warning, enter the venue at your own risk. Facility assumes no responsibility for the spread of infectious disease. By entering, you agree that you are accepting responsibility for your own personal safety and the safety of others by following all CDC recommendations, guidelines, including social distancing. Avoid touching your eyes, nose, and mouth. Please bring and wear a face mask covering your nose and mouth. Utilize hand washing and sanitizing stations regularly. Do not enter a venue if you're susceptible to illness or showing symptoms of infectious disease. By entering the venue, you are acknowledging that you are releasing the owner, all sanctioning and participating parties of liability. The act of entering the venue hereby releases, waives, and discharges the covenants not to sue the venue, event organizers, or affiliated parties. So those are going to be posted at every gate. And, there's a part that I'm trying to figure out exactly what we're talking about when it comes to enforcement of the fair, is how do you get people to engage? And part of it is advertising, I think, in the first part. The other recommendation is put some of this information on the back of the ticket. And that's what they've recommended on the rodeo tickets, is put them on the back, that verbiage that says, look, if you're not safe, don't come. And I think that's where it comes down to, again, what I said earlier, is as citizens, we have a personal responsibility not only to protect ourselves, but others. And, for the grand scheme of things, going to the rodeo is great, it's fun, it's local time, but at the end of the day, if you're sick, stay home. And, I think that's the best we can do. But I think from a liability aspect, that should cover first the contestants like Sean and I talked about last night. this isn't gonna be their only rodeo, so they should be following the rules completely. Or else they're gonna get probably sanctioned or fined by the NRA if they don't do what they're supposed to do. And I think they're very clear that if they don't follow the rules, they don't get to participate. And so, I think for the most part, these Cowboys and Cowgirls, we've had a lot of events canceled this year. They're wanting some money in their pocket and get some standings in there, or some ranking in the standings there. So it's important to them. I won't say that every Cowboy and Cowgirl at the Boston Garden Arena is there for anything other than look at me. Sometimes I call it I got on a bull event, not a bull riding event, because everybody can get on, but no one has seen the last 8 seconds. It's one of those things. But I think that we can put some stuff out there as best we can, and protect people quite well with the gang clean stations. And we talked about, I think Sean and I talked about it, Bill and I talked about it. How far do you set your table apart? How do you adjust your lines for food and drinks and things of that nature? And really, I think the space is there. Those things are all capable, and I think part of it, like I said, advertising before the event. The other part of it is having throughout the thing, have the announcer just go on the look. Don't get bundled up in large groups. And let's go back. Right now, currently phase 2 is 50 people in one group. So you could put 50 people in a group and go 6 feet by 6 feet, and that's the standard of social distancing. That's where we're at. So it's not that we only have 50 people in the arena, it's the whole concept. But I would like to see, I was going to try to talk to our board about maybe getting some extra bleachers in just to space people out of fun. Thursday, Friday is not my concern. Sunday's not my concern. Saturday is my big concern. Saturday, our Tough Enough to Work Pink Night has blown up to be a huge event every year. Last year we had 1,064 people, I think, in the stands. That's a problem. That's something that has to be dealt with in a fashion that will the community safety. So maybe renting some bleachers or something to bring people farther apart is the best solution there, and that's something that the board has to decide. But or we just limit the amount of tickets that are sold, and that's another option as well. But we got to change the game a little bit. But in the grand scheme of things, like I said, a lot of people said this, and I think everybody's heard it. I would just call it the Broadwater Rodeo and Fair protest. So at that point, under the current past practices, there's not really much anybody can do by calling a protest. And we've seen that with the protests around the state. So by calling a protest, we can get away with damn near anything in the world. And who's going to do anything about it? And I think that's the problem. That's the big problem. We allowed something that shouldn't happen. We kind of got double-edged sword. Good, you want to go stand on the street, you can do whatever you want. You want to go and spray paint people's houses and everything else, go do it. But if you're a good working citizen who just wants to go out and watch an event or participate in a fair or rodeo or whatever, we want to stop you from doing that. And we have created quite a social debacle in our country by doing this. So back on mute, unless somebody has a question.
And I guess to add to that discussion too, I'd like to recap a little bit of our last meeting too, because there wasn't a lot of people here, but we made a lot of points as to separating what's recommended and what's mandatory. And it was the position of the sport at that time to put great emphasis to only, for the most part, follow state directives where we had to, and then leave it up to personal responsibility. Because Daryl brought up the point of, we definitely don't want to have to make a rule for every little thing, and that's not how our country works. So no, I'm in agreement there.
And the thing is, you think about it, I get it to a point when we talk about the serious of the number, 600, I think you say 656, I think is what your number was today for total cases.
Oh.
I might be wrong, but it's 600 and so. And the problem is that we use that to politicize this event. And the fact is, we're looking at numbers of total numbers. Well, great, we're great. We got 2 million total numbers across the nation. However, majority of those are recovered. And I think that when we continue to use that big number, we're still trying to place that fear into the American people. Instead of just saying, look, right now we have 92 active cases in the state of Montana with 8 hospitalizations. And I think if we use those numbers, people are going to relax a little bit and the tension's going to come down because the tensions are very, very high. And I think that's what we need to balance this out a little bit, in my opinion, is that we need to understand that there's a vast number of people who've been affected by COVID-19. But the reality is that we're at today. And find that happy medium and keep people from getting escalated in their thought process of that the world's coming to an end. I've heard this numerous times, the world will end on June 21st. Great, I'm happy. That means I can retire. So, but that's where people's mindsets at. And I think as a government body trying to do the best for the community, we have to keep those things in mind, not necessarily always talk about the worst case scenario, nor talk about what totality of the situation. I mean, we don't continue to talk about 9/11 victims that continue to die today from cancer. We just talk about the 3,000 and some that died on 9/11. We don't talk about the 60,000 that have died since then. And so I think that's an important concept to remember as well. When we do these things.
So when I'll throw this back at you, then
Sure.
Where do you think we should draw this line? What amount of restrictions should we be doing for this? I mean, do you think that we should just walk away from it and not think it's a problem, or do we come up with a reasonable plan that we do? But the plan in my mind, as I've said, can't just be a paper plan. It needs to be something, and that's why we've been trying to work with the groups. But how far do you think we should back off from that? I mean, with all this being said, where should we go?
Well, I think it depends on what side of the fence you want to stand on. Some people say that wearing a mask all the time is unhealthy for you. Some people say it's very healthy for you. So there's two dynamics on how you want to look at it. However, I think you take the aspect of providing as much as we can in the guidance of safety, no different than, and I'll use the NRA's guidance is we're recommending you wear a mask. Bring it and wear it. And I think that's what we do. But the same point is that if they bring it and pull it off their face, which we see so many times, they'll hang it down below their face. Well, do I go over and slap them on the head and say, hey, put your mask on? Or do we say, you know what, if everybody else has got the mask on, this guy doesn't, where's the fine line? And I think that's where it is. I think we just got to give people the abilities. I think we make recommendations all day long, but, make it applicable and reasonable. And I think people are going to fall in line. I think if we mandate things, people are going to balk at it. And I think that's where people are having problems because of being mandated to do things. And that's ruffling the feathers. And, because that's not, as Robbie said, this is not how this country was developed or built. We didn't mandate them. As a state, we only delegated so much authority to the federal government in order to act in our best interest under the 10th Amendment. We didn't ask them to run our lives for us. And so that's a huge part of that. So I think we give them guidance, we make recommendations. Look, we want you to wear gloves if you're serving. We want you to wear a mask. We want you, if you're coming in, you're sitting in a group of people and they're not your family, if you would, please wear a mask. And I think that's all we can do. I don't think that we can go and say, you can't live your life anymore unless you wear a mask and glove. And I think that's where we start having problems. But I don't think that we need to walk away from this and say, hey, this isn't a problem. We obviously know it's a problem. And so, but we gotta find a happy medium in between. And so I don't know if that helped answer your question, Sean.
Well, I think, what I'm trying to just make sure is that I understand your comments, but I also know that you and I sit down and talk about implementing a plan that's doable.
Yeah.
And so I want to make sure that the understanding is that still out there that I think Wynn is not saying we don't need a plan, we can just do this rodeo
Oh, no.
like we've always done. I mean, I think we, I'm just pushing back or just making
No.
clarification that we, we need to have a plan. This is an event that is above and beyond the 50, and that's what we discussed in the last meetings. Anything over 50 people, we have to have a plan, and it has to go through Teresa and I, and then if Teresa and I feel like the Board of Health needs to get involved, we will do that as well. And so I think that's, from that standpoint, I want to just make sure that the public knows that it's not as simple as, I understand all of that, and I don't want to, we don't want to mandate things that are not doable. We don't want to, but we also have to use the resources and common sense that we have been doing and for plans, and we've been starting to see how these plans how they work and that. So
Yeah, my goal is to take the two plans the NRA's put out and develop a plan strictly for the Broadwater County rodeo and put that in the range. This is great on the state level. We need to individualize it a little bit because every event is different and every facility is different. So we have to have something that's accurate in what we're doing. I want you to see the guidance that they're giving, so when I do get the plan done, at least it looks similar in nature to what the RA is recommending and what they're saying as a sanctioned event. So basically everything that's in here needs to be in mind, except the fact is we probably have something that's a little more actual to.
yeah, we got specifics with the concessions and things like that we've discussed in that. One of the things that was brought to my attention since the fair meeting is one of the big issues that we have been able to do with most of our events is have a registration so that we can do our contact tracing. And that is a big thing for us at an event like this. And I think we need to have that discussion on whether there's a way to, I'm not wanting to go beyond what is appropriate for, people may not want to register. I get that, but for like, say the fishing tournament or the rod and gun club thing, they're registering anyway. But we need to be able to do callbacks if there's a problem. And if you want to drain the entire county's resources, that's what would happen if we had to do a contact tracing back for the fair without some sort of registration. Now the rodeo is pretty simple, I think, to do some of that because you could sell your tickets online or something like that. Or do you see what I'm saying? I mean, that's a big part of what we have to consider right now. So anyway, I think that's something we have to have a discussion. That's for everything. I think the 4-H, we can do that as well because the buyers will be there and we also know who the sellers are or the kids and that activity. But then when we get to the actual fair, that's a tricky thing.
I agree with Sean. It's huge. When I talk to the other big health departments, even Lewis and Clark, with just a few increasing cases that they've had with the community spread, honestly, if we had an outbreak from our fair, we would probably end up hiring 10 nurses to help with public health just to do contact tracing. And I'm not kidding. It is a lot of work. There's 4.5 on average per person. So if you have one person that has COVID, they have an average of 4.5 people that they have been in contact with. That doesn't seem like a high number, but if you have 50 cases that we come up with that COVID, that's what, 250 people. My health department cannot handle that. We would have to hire numerous staff to stop it. And that's the main thing, is that if it happens, we hope it doesn't happen, but if it happens, we have to get right on it and get it stopped. Get these people isolated, get the other ones quarantined. it would be a disaster for our county. So I really believe that we have to have some kind of form so we know who's there just in case. And we're not gonna get them all, but we go through this every year with other diseases that come from the fair. You know, waterborne diseases, foodborne illnesses, you know. I end up with a bunch of people from Broadwater County that goes to the Bozeman Fair, and they have a bad food booth, and we end up with Campylobacter, something like that. We do the same thing with those disease processes. We have to find out where it came from and who was all exposed to it. So anybody who has food out there, we're responsible for that communicable disease process as well. So, so that's nothing new to us, but when it comes to something like this, you know, we could be talking 200-300 people or more, and that would take a lot of resources. And I can't stress that enough.
So in college, I worked at the Great Falls or the Montana State Fair, and they charged a fee if you had to pay to get in the gate. Not that I'm asking you guys to do that, but we, you know, there was a choke point always. You had to go through a gate, and it took time. Like people had to wait in line. So I don't know if it can be part of the plan, is to just have people write their name down and a phone number. I don't think that's asking, and maybe even just acknowledging that they don't have those symptoms. I mean, I'm not trying to step on any civil liberties or anything, but I think that I don't think asking someone in the way that Corey has presented that, it's just, you don't have to say if you have any of the symptoms, you just say, or which symptoms you have, you just say if you had yes for any of them, you just have to turn around and leave.
And the governor has made that very clear, that is not a HIPAA violation of any kind. So, so if anybody tells you that, you know, you can reassure them that it is not a HIPAA violation to ask if you have any of these symptoms. So, you know, some people are like, well, that's violating my HIPAA rights. It's not.
Dr. Campbell, do you have any input?
I think just asking people about their health status is fine. I think taking down people's names in the public event smacks a big rug. It's something we gotta get involved with.
No, I just feel like, you know, it's not a normal year, and we aren't going to be able to do this normally. I think we can do it, but people have to, you know, meet us halfway so that we can protect our community. That's our job, and we don't want to be hard-nosed about it. We don't want people, I mean, people already hate public health, even though we're the ones that are trying to save their lives. You know, they have to meet us halfway. The CDC says day after day, masks save lives. So, you know, I don't want to make it mandatory necessarily, but a recommendation means I don't have to wear a mask. That's what it means to me. Just a thought I'm putting out there.
When's the first state held rodeo, I guess? Do we know
We
that?
already had them.
We have?
Yeah, the state finals were in Baker 2 weeks ago. 3 or 4 weeks ago was the high school finals over in Sydney. Terry had a rodeo back in May. Popular last weekend. So we're looking at, I mean, once we get into the 4th of July weekend's really the Cowboy Christmas for Montana. So we have probably 7 or 8 NRA rodeos across the state. I don't know who's all participating. Some of them have shut down. I understand the State Fair in Great Falls shut down. Obviously, they get tens of thousands of people through the door. That's an environment that's a little harder to control and keep people in line with. I get it.
Plus their rodeo's inside, isn't it?
No, but they have the concert and everything else, and they got a whole bunch of stuff that goes on there. But, I think that, for the most part, some of the smaller NRAs, they're gonna just keep drugging. So if it's going up, and that's it. I don't know if they cancel it or not. But, there are some that have canceled just because they don't have the means and don't need control. But, so I understand.
I guess what I'm getting at, do you think it'd be possible, Sean, to get a copy of the plans that they implemented just to take a look at for our own discussion?
Yeah, I mean, we have tried to get some of those, and I think that's what Wynn has provided with the NRAs.
Right, the NRAs, but I guess I like,
Those are 1 and 2, so.
okay.
There's phase one and phase 2 there.
I guess I'd like to see some other plans too of what other counties have had too. And
I
then
can-
also to be added to this.
I can get plans from anybody, because the public health departments are the ones that have to, review the plans, with their sanitary and environmental health department doing the food and everything else. And so, we have meeting after meeting after meeting, and we all share our plans. We all talk about what went well, what didn't go well, and we all learn from that. And because, it's everybody's first pandemic, so we have to rely on each other to find out what worked and what didn't work. So if I can find out who had fairs, I can get plans from anybody.
You text me your email later, I can get you the Terry rodeo plan that they submitted, which kind of started the whole.
Well, that's the very first one.
So.
I don't think I have that as well. Because that's what we based the Thompson event on.
Yep.
Right.
I think we want to focus on, generally what I do, when I'm doing plans for other things for public health, is I just focus on, a similar frontier county, size-wise, because we're not a small county, we're a frontier county, so, I just focus on those counties and, see. I'll see what I can do.
Yes, Nicole, did you have?
We do have online comment. This is from Bobby at the Broadwater Reporter. She states, if the County Board of Health shuts down the rodeo and fair, it would be yet another financial hit to the economy in Broadwater. It's an outside event with very little possibility of spreading COVID, also a hit to the community morale. And then she had a follow-up question. Is the official public health officer, Dr. Campbell, involved in these decisions and plans?
I would say yes. I guess my reply to it would be a hit on the economy is, do you want your business to flourish for one weekend, or you want it, and if you get COVID, you go back to phase 1 and you're shut down for 6 more months. And that's the kind of way that I look at the whole thing is, yeah, we can have this weekend and do what we want to do here. But the problem is that if you end up with a virus, which you've got a pretty good county in Gallatin next door that has a lot more cases than most counties, you're inviting everybody in the state. So you're going to have one weekend where you get a big punch in the arm, and then you're going to, most likely, you're going to end up with 6 months where you're shut down. Because the other issue that I have is are you having concessions? So if you're going to have concessions, now you've got the wrestling club selling burgers. A week later, football starts. So now you've got all of those kids. They haven't even been through a 14-day basic quarantine period, and now we're going to open up the school and start having football practice and volleyball and whatever. So now you've got all of that going into the school. So now you've exposed the entire county, and you have no way of regulating it, of who goes where, because even the plans, and one thing that people from Teton County said the issue that they had with theirs was the induction of alcohol into the whole system. So are you not gonna have a beer garden? If you got a beer garden, people are gonna congregate more than 6, 10 people 6 feet away. So you really have no way of controlling it. You have no way of controlling it. No matter what you do, you're not gonna control that. But by opening this up to everybody within, whatever miles they wanna travel, and I'm pretty sure rodeo people are pretty getting starved for seeing a rodeo. That's what they like to do. So if you're going to be the only one, that weekend, you're going to get a huge crowd in here. I think more than you normally get. And so you're going to have all that influx of people coming in, and we have essentially exposed the entire community to that. And yeah, we had a great weekend, but you know what? For 6 more months, on top of being winter, we're not going to be able to have business because we're back in phase 1.
But like, on the food program part, Sean and I talked about this yesterday. The restaurants are already serving people, and they're not even required to wear a mask. So, that's one thing, but like we said, we could put plastic or plexiglass up between those and slide food back and forth. As long as the people inside the concession stand wear a mask and gloves, what's the difference? And the same breath is we're getting stuck on the 6 to 10. That's phase 1. We're at 50, and we're at 50 people per group. That's phase 2. It's not 6 to 10, it's 50. So I get it, but the same breath, and I'll argue till we're blue in the face, is that we're infringing on people's ability to do things. And I have a right as a citizen, no different than you do. If you didn't want to come to the rodeo because you're afraid of catching COVID, that doesn't pan on me. You don't have a right to tell me I can't do something because you're afraid of COVID. Nor does she, nor does he, nor does the governor, for example. And the governor hasn't used mandatory executive order. He's using guidance and directives, recommendations. That's all we have the ability to do is recommend. From a legal aspect, that's all we have to do is recommend. So I get what everybody's saying, and the fact of shutting things down, we're gonna end up in a civil revolution beyond belief the way things are going right now. But the fact of the matter is we're in phase 2, so we gotta plan for phase 2 and put that responsibility back on the citizens. Like I said earlier, if you don't want to go because you're scared, stay home. Yeah, I get where we're at, but the other part of that is we've only got a certain capacity. And we know we have a COVID issue right now, that we can't have 1,100 people in our arena. We already know that. So that's going to be a change that has to take place. It might be the fact you only get 800 tickets or 600 tickets, whatever's comfortable through guidelines on social distancing. I don't have a problem playing that particular game. But we can limit that. Once the tickets are out, they're out, and the gates are shut, and have a nice day, right? No different than going to a concert or going so many tickets. Drive-in movie theater last night, so many tickets. That's just the way we're gonna have to do things probably this year. But the fact of the matter is it's not about we're afraid of something we can't see. So this is no different than being afraid of a ghost or even coming down and abducting you. You don't know they exist. You don't know where they're at. So we are living our lives in fear based upon what? The fact is we might get something that we can't see coming at us. It's no different than the flu. The flu kills 1,000 people a year. Cancer, we can't see cancer coming, but we don't stop our lives and stop our world because we're afraid that we might catch cancer, right? People have heart disease, kills hundreds of thousands of people a year. We don't stop living our lives. We don't stop eating McDonald's burgers and going, are we going to get heart disease? That's something we're born with and we're going to die with. So it's the same concept. This is the craziest thing I've ever heard in my life is we stop our world based upon something we can't see coming. It's not the blue speck in the sky that's going to say, oh, there's COVID. Stay away from me. I can't do that. So I get it, but our job is to make policy that's best for our community. That's all community, every citizen within our community, not upon people that are in fear of whether or not they're going to catch COVID. And let's be honest, not every symptom is fatal. So we have people in this community that are in this state that the worst condition or symptom they have is a runny nose and a cough for 2 days, but they were COVID positive. So not every case is going to end up on a ventilator in a hospital with IVs stuck out of your arm. And that's something that we have to keep in mind as well. So,
I just want to make a comment about that. The governor does issue guidance and directives, but it
Great.
also gives the Board of Health the option to make the rules as stringent as they want to be. So, I just wanted to make that a public comment. So, he does the best he can with DPHHS on what everybody needs to do, but the Board of Health has the right to make those rules as stringent as they want to make them.
Mark,
Yeah.
I have,
Tim?
Oh.
Go ahead, Deb.
I just thought I've spent a lot of time in Ennis. For whatever reasons, as you guys compare other counties, Ennis Rodeo is a go-ahead. So whatever their plan is, you might take a look at it. For whatever reason, they canceled the parade. So they canceled one thing, but they are moving forward with the rodeo. So there might be a plan there for you to look at as reference.
Thank you.
Yes, Tim?
They can still have a rodeo and parade.
Tim with Readout News. I've been covering quite a few counties with this process, looking at what they're doing. And I'll use Gallatin County as an example. When we went to phase 2 under the governor's directive, what they did was they wrote up their plan, if you will, and they did this. And when they got to the part of recommendations, they made a mistake of putting in mandatory recommendations. And the word mandatory flared in front of the people. And there was like the first time in history of even Gallatin County where there's a lot of things going on. They ended up with probably about 800 comments came in opposing their plan. It turned the city, the community really against the health board. And so be very careful in using the language that you decide on in developing your plan here, because if it's wrong, Sheriff Meehan made a comment. We're seeing protests that are going against everything that's happening in a lot of ways, and we don't want to have that in Broadwater County. I personally, as a citizen here, don't want to see that happen, but we gotta be moving careful.
I guess I'd like to make a recommendation for further discussion and time to review of the plans on this
Well, I mean,
matter.
that's just it, we haven't seen the plan,
Right.
so, I mean, I don't know where they're at.
I think the fair folks, and I don't know if they want to comment, but, I think if the board's plan or thought is that it should just be a no-go, I think they need to know as soon as possible. If it's a go with, some work based on plans, I think that's, is something they need to know as well. I mean, I'm speaking for them, they can do that.
I
but
guess based on what we discussed last night, I'm comfortable going forward with the 4-H side of things. I think that Jason and Allison have developed a pretty good plan for what we heard, listened to them last night, that we can go forward on the 4-H side of things. The rodeo and the fair side, I'm not comfortable with right now.
Thank you, Darren. If I could just make a comment. I know there's a lot of issues to think about with the rodeo and fairs, and there has been several that have been canceled across the state. But I'm looking forward to be able to present a plan, hopefully in maybe next week, if all goes as well. And across the state, there has yet to be a 4-H portion of the fair that has been canceled, even with rodeos and the actual fair event being canceled. The 4-H portion has not yet in any part of the state. So we appreciate the support, and we have been working hard and do have something hopefully soon to present to you.
But I actually reached out to Teton County this morning, and they sent me their 4-H plan,
Yep, I have too.
so I'll send that. Do you have
I
it?
do, yeah.
Okay, I was gonna say, I'd give that to you, and you could use that if you need to.
Yep, I have
And
it
you
before.
have additional guidance,
Mhm.
so.
I guess because we at least know, like, even if you give us a plan, we're not gonna even consider it. I mean, because we have people wanting to enter and it closes in, well, we moved it to July 10th now, but and we have a lot of money to start putting down, and I know that is at our own risk, but if it's like, yeah, you're gonna give us a plan, but we're still gonna say no, like, can we at least know that that's not the case? If we give you a good plan and you guys like it, that you would consider it, there's some kind of guidance we can get.
What I'd like to know is why, what's your hang up with the rodeo? And what part of that? One, rodeo is an individual sport for the most part, so, I mean.
I don't have a problem with the rodeo itself, but when we invite, how many people you say you're gonna come?
Well, we usually have 300 some on kids' night. That's all usually family there to watch their kids and grandkids. Last couple of years, Friday night, we've had somewhere between 550 and 650 in the stands in the whole gate for the Friday night performance. Friday night usually slow. Saturdays, like I said, is my big concern because that's our big night, and we usually have anywhere from probably 900 to 1,100 folks. So that's obviously a concern that I already recognize. But that's every Sundays. Sundays usually that's family day anyways. So majority of the people that are there to watch their spouses to participate. So it's usually, I don't know if you get 300 people on a Sunday night or Sunday afternoon. I mean, those stands are pretty bare.
Still planning to have the Thursday Broadwater days.
Yes.
Yeah, well, don't they usually have kind of some of the local?
That's Sunday.
Is that Sunday?
Yeah. So the adults are Sunday, kids are on Thursday. And I mean, for the most part, I mean, it's, Josie's got 3 kids that participate in it. Most of those kids are, in the grand scheme of things, most of them are related because we don't have a big group of, I don't mean this.
Yeah.
Yeah,
And I understand. I guess where I'm going with that is it's all mostly local folks.
yeah.
That attend those events.
And it's like it's hard to get the kids, we try to talk about getting kids and adults in the same one because the amount of little kids that are participating in rodeo events is just getting smaller. And so we don't have quite the dynamic. So, we used to have a lot of kids that would participate in that. We just don't have that. And even on the Western Days adults event, we don't have as many young kids that participate or young adults that participate in that. They've moved off, they've gone to school and got their own families and jobs and moved away. So that number isn't what it used to be either. So it is still a long event to try to run them both together on the same day. So,
Actually, we have good questions too.
there's only a couple of them, isn't there? Oh, was it 12? Yeah, 12. Yeah. I get Saturday though. I do, and that's one of those concerns. So I said it might be trying to find some different bleachers separating people out. I get that. I'm not against it, and I'm not saying I don't want to do it. I just say need that. What Josie said, I have to go rent bleachers. That costs money, and what people don't realize is that the stop contract alone, I think, is about $26,000. So there's a lot of money that's invested into that.
So speaking of that, say what if something happens that's out of our control? What if the governor says we're not doing anything like that? So you guys, you're out, right? I mean, there's no going back.
We beg, butter up to Dick Lyman and see it work with us a little bit. We understand that, but there's a very large risk by doing it, and for financial ways. But we're not reinventing the wheel here. This has been done, and in reality, we had the high school finals in Baker, Montana. And if you haven't been to Baker, they put a lot of people on. They tried to do the best on the area they got. But you saw every high school kid at rodeo sitting out there with their families. And they've had pretty strict guidelines. They weren't allowed to stop at the gas stations. They weren't allowed to stay in town. could stay in their camper or roll in and roll out somewhere else, but they weren't allowed to congregate. And that's the thing. These contestants know that. You know, the social distance between the trailers, 12 feet between a truck and a trailer. They already know these rules. So that shouldn't be a huge overstep.
And I don't think it's the contestants
No.
that we have an issue with.
But the problem is,
Rodeo staff or anything like that.
But even if I have to limit the amount of people through the gate, the rodeo is, that's the thing I'm getting at. The contestants still come to this gate if I have to limit the amount of people that come to the gate. And, for some of these kids and young adults, this is their life, this is what they do. And trying to keep up, in that first ranking or second ranking in the standings is pretty important to them because for that finals attention. So, that's the public I get, but I think everything else would be fairly swift.
So from the fair standpoint, Julie, as far as her exhibits and things like that, I mean, you guys, we talked about that last night. That seems fairly doable. But like the concert, I don't really see that happening. You're asking my opinion, I'm giving it to you.
What about the other entertainment that we have scheduled?
Like what?
We have music under the blue and white tent where the slab is,
The what?
that concrete slab there.
Mm-hmm.
We have every entertainment that is coming in
Right.
or scheduled to come in. What about that?
Well, there again, I mean, what's your plan to have that distancing? I don't know what that plan is.
What about the concert? If we follow the rodeos thing with their seat, how's that any different?
We haven't said we're having a rodeo yet.
No, I'm just saying, if I use the same plan, like why couldn't even be considered? I guess.
I would consider the concert more of a social event than a spectator event. Everybody's, close to each other. I mean, that's how I look at it.
I think I would agree with that.
I don't think there's any way that we can control kids at a concert. So, I mean, I want the fair to happen as much as everybody else does, but people have to realize it's not going to be a normal fair. It's just not going to be. We can't compare COVID to a ghost or heart disease. It's a very contagious, deadly disease. We had the gun show early in this process in Bozeman, and we had 2 cases in Broadwater County from that gun show. And after all of the contact tracing was done, there was multiple people all over the state that came up with COVID from the gun show in Bozeman. So that tells you it only takes 1 or 2 people to go to an event and bring it back to a community. I just can't stress enough that, if somebody comes down here from Bozeman that happens to have COVID, it can cause an outbreak. It's very contagious and it's very deadly, and you have to remember that.
I guess part of it is it's not the person that has the symptoms, it's the ones that aren't,
Yes.
don't have the symptoms, don't realize it, and they don't show up until maybe 2 or 3 days after we've had our event, and then then that's when
And
we
they've,
have the issue.
they've resumed their life and went back to work in Helena or Bozeman or wherever and exposed their families. It's just, yeah.
Commissioners?
I'm sorry, I know this. I'm struggling with something, maybe Sean and Teresa can help me understand it. If you go to the commercial bar or any bar right now, I think the tables are limited to 6 people. So I could have 2 of my friends from Bozeman, 2 from Great Falls meet me. We can sit at the table and have beverages. So what's the difference? I understand there's a math, there's a numbers.
Well, to be honest, I struggle with the exact same thing.
Okay, so I'm not alone.
No, I think it's ridiculous based on what we're trying to do elsewhere.
That's where
They've
the
never
confusion
clarified
comes.
that, and I've asked for clarification on that. Because how do we implement other family unit type policies? So.
Well, and it all comes down, so that situation all comes down to personal responsibility.
I think
You
it all
know,
does.
if you invite 2 of your friends from different communities to come and meet with you, they're gonna go back to their communities, but you're the one that's gonna stay in our community, which is what we are worried about. And, potentially, you know, start something in our community. It really comes down to personal responsibility. You know, we can argue every point there is when it comes to this. We're talking about a large scale event that we are responsible for. And personally, we have to make good decisions to protect our community. That is our job.
Yes, Tim?
Just a question. One of the things that, again, I've been covering a lot of these meetings that are regarding the Health Board of Health. Moving forward, there's a big question on the accuracy of the CDC numbers going across the country, the spikes and the differences. There's a lot of questions on that. I don't have the answers myself. I'm just hearing that a lot, not only from officials, but from citizens. And another one that's coming up, making this case here today on how we plan forward in Broadwater County. Just earlier, the flu seasonal, the numbers there with 26 deaths and 84 cases tested positive, comparing that to what we're looking at with the COVID, that's another factor that seems to be a lot of people are saying, hey, what are you doing here with this as in comparison to the normal flu? In other words, I think it was stated, why do we want to run from the ghost that we don't know nothing about and it's going to happen anyway? Again, that's what we're hearing. And it's not right, maybe as it isn't, but it is what we're hearing.
It is. What I can say to that is we don't have a vaccine for it. We don't know what's going to happen with this. We don't know that much about it. We're learning. We know about the seasonal flu. We can predict what's going to happen basically from year to year. We know a lot about it. We've been treating it and vaccinating it for years. We don't know about this virus. It changes almost daily. You know, now we have a different kind of disease that is caused from COVID that's affecting children. It's evolving, it's changing. We don't have a vaccine. And I don't expect people that are not in the medical field to understand all the epidemiology behind this, but I can just tell you that, you know, 2 years down the road, when we know everything there is to know about COVID, we're going to be in a lot better shape. Right now, we don't know. And so that's what's so scary about it. And a lot of people think we got into phase 2. We haven't had any more cases in Broadwater County. You know, we're in the clear. You know, a lot of people are just kind of like it's not even here or going to happen. And tomorrow we could have an outbreak. So you know, like I said, that's our job, is to just keep doing the best we can with the CDC and the governor and all the recommendations, and try to protect our community. It's the unknown that's so scary. That's, I mean, if you watch the news reports at all, that's what they're all saying. It's all the unknown factors that are worrisome, because it could happen in 2 months, or it could happen this fall when flu season hits again. How are we gonna know what it is?
Or not at all.
Are we gonna have, is it gonna be the seasonal flu, or is it gonna be COVID? Who knows? I mean, you could get all the same symptoms and you could have COVID instead of the seasonal flu. And there's no treatment.
Vaccine for flu changes every year as well to keep up with that changing.
It does.
So again, I'm just saying, that's what we're hearing.
It doesn't necessarily change every year, but some of the strains change a little bit. But we know how to treat the flu.
Totally
So,
different kind of virus. The coronaviruses and influenza viruses are very different, so.
Yeah, it's a whole different beast.
Again, I'm just telling you what people are saying across the state of Montana.
I guess another question I'd have is, why are water parks allowed to be open at capacity of 400 people? Like, yeah, it's totally different, but in the same token, it's not, because it's a large group of people in an area touching the same things over and over again. Like, I just don't understand. I guess I don't know what water park have to follow. I have no idea, but,
I don't know that that's true, to be honest, but, perhaps. But if it comes down from the governor, there's not a lot we can do about the guidance. We have to use the guidance and the professional, backgrounds of the folks that we have in this room to try to help make those decisions. It's not easy.
Within the bounds of the Constitution.
So are we pretty much in agreement to table this until next week and try to get plans from the rodeo, the fair, and 4-H to go from there? Is that the consensus of the board, or where are we at? Yeah, well, we need to see a plan.
I don't have enough information to vote either way right now.
Yeah, we need to see the plan, see what the controls are gonna be. I know we talked last night about the dance for the kids and where we're at with that.
I'll just add the one comment. I'm not against the fair, obviously, I'm not against the rodeo. My responsibility, my portion of it is with the 4-H and the kids and the plan that we put together. And I think all of us together just have to recognize that it's gonna look different. We all have to make some concessions. We all have to make some changes. But in order for it to go through and give our kids, our community, as close to normal as we can, but we need to go into it recognizing that it's gonna look different. Fair's made plans for probably over a year now, things they want to do. Rodeo, same thing. 4-H, we're working on our plan. We've axed some things out, things that those kids are gonna miss. They're important to them, but we had to do that to make the end goal come to reality. And I think we can do that. I think the fair can do it. I think the rodeo can do it. But everybody, all parts, all boards, however you want to look at it, it's just got to recognize that it's gonna have to look different and be normal. We all just have to accept that and be willing to do what we can. But we know it's gotta look different. And we just,
And it's the thing is, be realistic in your goals and what the outcome's gonna be.
So Sean, when do you think we could have another meeting?
When are you available, Robbie?
Fridays.
We wanna try to go next Friday, or we wanna go another week after that?
So we want to get these guys an answer soon.
So we'll figure on, hey, get those plans to Sean, and whatever plans you guys come up with, and he can review them, and we'll go through them. I know we'll meet again on Friday on,
And I
try to get
may
a
or
decision out at that time.
may not be here next Friday, but I can work with on the plans and that prior to, so.
And then 9 o'clock? 9 o'clock on Friday?
Yeah.
So Win, if you want, we can go out to the rodeo grounds and look at bleachers and that kind of thing, you know, for spacing. I mean, I'm willing to meet with anyone out at the site. It makes more sense to try to figure out solutions on site versus on paper sometimes.
When are you going, Sean?
I'm just offering
Well,
to do that, and,
If we want to run out there.
Yeah.
Yeah, we can go right after this. if you guys want to.
I'm available.
I'm available.
So I mean, it's, might be is
I'm usually available.
8 days, but. I don't-
Yeah, but
I don't know if I have them in the truck or not.
I have tapes,
Okay.
so I'm always measuring dirt.
Somebody measured dirt last night for the movie, so. Well, that's on the road. Yes.
Okay, so we'll go on to new business. You got any new business report for us, Scott?
No.
No, okay, thank you. We already went through the fair and rodeo, report from new business from the public health nurse. You got anything, Teresa?
I don't have anything new.
Okay, Sean?
I just have that, the contract for the state for the food service is being modified. Now my understanding is all the work that I have been doing with the restaurants will count as inspections. So that's good because right now you guys have been paying me to do that and we haven't been, the contract didn't allow for reimbursement, but they're modifying that to hopefully cover my costs for going to those and working with the restaurants as they reopen. I wanted to just mention that we should probably start thinking about whether we want to, last year we had Melanie Shaw through me, she's a registered sanitarian, do the food inspections. Now it would be a good time to do, I don't think anybody wants to go in and do a full inspection right now, but it's a good time to get in and do some education type inspections. And I think that, I'd like you guys to consider having us start doing that now. But I'd like to just do it like we did before, which was the state contract amount was close to $5,000. And I just said that I would make sure it got done based on that value. I ran a little over, but I only charged you for what you were reimbursed.
So do you work on that contract? Is that how that comes about to the state?
Well, I think it'll come to Michelle. And I don't know how, I actually don't know how it works, but it comes from the state to the county. And I will review it this time.
Yeah.
To make sure that we are covered in what I've already done. So. And did we talk about the tires? Did I talk to the Board of Health about the tires? So we did go out I went out with DEQ last Tuesday to the Two Brothers tire site that is under litigation right now. And while we were there, we found additional tires, about 1,000 extra tires that they had not indicated were there. That was at the Winston site, and then we also went up to the Radersburg site and visited they have a large shop. It's about 100 by 150 feet, and it had what we're estimating is 5,000 tires being stored in there. This is all a DEQ enforcement. They did just ask that I attend the meetings with them to have a local presence there. That's just kind of the update there. DEQ sent basically their findings of fact, I guess, and this is all going through Corey and the county attorney's office and DEQ. So I was just there to be the local person, I guess. So, so that's an update on that. And I think,
Well, any update on the silos and all the,
it's not the highest on my radar right now, I guess, is it will be. I think next week I'll be working probably mostly on COVID plans, so it's going to be another week or so before I get, that becomes a priority. So it will become a priority, but just right now, I think we have to focus on this COVID-19 stuff. So. Unless you tell me otherwise, I mean, that's just how I'm prioritizing things. So.
Anybody else have anything?
Yes, again, just kind of give you an update on what's going on with the jail, and how we're dealing with, some of the COVID stuff, and what we're working towards. One of the things obviously was a big issue was getting people in front of court. And so, obviously the judge is doing their stuff and everything else. So we're looking at, Border Crime Patrol has, some grant money out there. So we're looking at doing a VisionNet system. Same thing as looking at in the courtroom, just trying to figure out how to get it in the jail. The problem is the current system that they're running is somewhere between $10,000. But we're looking at different options, and we're talking about maybe changing it up a little bit. But that's one of the things we're going to go to and make that more of a standard practice instead of taking those people out of the jail and taking them over to court. We're just going to do it right there. They do their initial appearances and stuff right there in the jail through VisionNet. The other thing, obviously, is trying to get people into see doctors for follow-ups on medications or even mental health stuff. So mental health's been really tough. I'm trying to get people assessed that way, or just even counseling sessions. So we did here, you guys probably saw the claim, Captain Rounds went out and got a tablet, and that's going to be kind of a telemedicine type thing. So they can go into one of our rooms there. They can get online with whoever, a psychiatrist or a counselor, whatever, even a doctor. They can have their session one-on-one, and then that doctor can give us the guidance on what we need to do from there. So we're changing that up a little bit instead of taking them out, so take them over to the hospital or clinic because of this. That's going to hopefully be part of the new practice as well. And then one of the things, like being a member of the National Sheriff's Association, they partnered with a group out, one of the big companies. They donated 2 masks for us for each staff member and for the inmates. So I got like 250 masks coming at no cost. They should be here any day now. So we'll continue to run that practice as well. And then the only other thing is, I'm sure commissioners are well aware, make them work together with the trust to approve standard policy through Lexipol. And so that, I'm trying to get the agreement signed on that. But I think that part of those policies now is going to be in infectious disease. Well, but that should be standardized across the state, and all sheriff's office should be similar in nature. In the core values of that policy, but all sheriff's office should be running under it as long as it may go in. But there's some of those things that we're working on in the midst of everything else that's going on around there. So, see if you've got any questions on that. We are seeing them, by the way, we are seeing some transfers of the DOC now. DOC's been transporting, like today, I think, Renzel is transporting a bunch down to Women's Prison, so they've kind of loosened up on their transport things, so we're starting to see a little more movement along the population, from the DOC side to state side. We get most people moved around our facilities a little quicker, so that's kind of where we're at. Okay.
Thanks, Glenn.
Thank you.
Anybody else have
I
anything?
do.
Debbie?
Debbie Randolph. This time I'm representing the Rod and Gun Club for their walleye derby. I emailed you that, I think, yesterday.
Mhm.
It was real quick. It's a draft. And their walleye derby is July 11th. Can I work with you this week?
Yeah.
The
I'll-
plan. I just took the same one from ATA event and kind of changed it.
Yeah.
Okay.
And I'm working on the walleye
Best
tournament
tournament.
festival right now.
I'm hoping the Rod and Gun Walleye Derby can get confirmed next Friday at this meeting.
What was the date?
July 11th is the Walleye Derby.
But how many participants do you think?
We never know. They're supposed to register ahead of time, and it's much better. They do that a lot more than the ATA event, but there are still some that come that evening. Typically, the average has been 50 groups.
Oh,
They can have, teams. They can have up to 5 people on a boat. One thing that we will do is we will just have, I'm working with Doug Brucker on this, is we will just have one person from each team at the rules meeting.
Right.
So those kind of things I will work on.
Yeah.
But I will get that to you all by next Friday's meeting, hopefully to get approved, if that works.
Yep. Yeah, so
Perfect.
I just need time to get it to Teresa because,
Okay,
you know, if you
I'll have it to
work
you
with
by
me
Monday.
and then, yeah.
I'll have it to you by Monday. Thank you.
I do just have one comment to make. I was able to order 300 gallons of hand sanitizer from FEMA. So when I found out about it, I had only a couple of days to order it, and it was either going to be a 55-gallon barrel or 300-gallon tote, and I didn't know which one I was going to get. And apparently, I got the 300. I haven't even been notified that it's been here, and it's been here for a week, so it's interesting how the
So we have
wires
hand
get
sanitizer.
crossed. But
We
it
have
is
a
for
dip now.
everybody, but there's gonna be rules, so I just need to make sure that I need to get in touch with Mike Myers, because bless his heart, he took that over because I had to have a forklift and all this stuff to, you know. So he owed me a favor, so he kind of took it over, but there is rules on how that stuff is going to be offloaded to people. But it is for everybody, citizens, hospitals, nursing homes, businesses, it is for everyone. And so as soon as I get those regulations, because you know, you have to have a sterile container. I can't bring in a dirty old milk jug and fill it up with hand sanitizer, you know. So there's gonna be rules, and you know, we have to decide who's gonna be, you know, divvying this out. I know Mike's busy, I'm busy, so we're gonna have to work out a plan somehow. It's over in the ambulance building right now, so I'm thinking that, I've already started sterilizing, like gallon jugs, and we may, you know, end up ordering them or just telling people that they have to bring in a sterile jug, of their own. So anyway, that will be something that we'll get out on the internet, probably in the paper, and get out to all the facilities and whatnot. So so that's a good thing. And then I also found out that we did not actually order the allotment of stuff that we were allowed from FEMA, which was a DES project, not a public health. So I was able to order a bunch of masks and different things like that. And I sent in my order, but I haven't got a confirmation yet on that, so. Just FYI. Everybody will have hand sanitizer now. That'll be nice.
Anyone else have anything else?
Adjourn. 10:42.
This is what I need for my deliverable
Okay.
for this,
You know, like,
they
are you
just
guys
wanna
gonna be
know